Hi, I'm Dr. Beth Onefrak, a clinical child psychologist in Phoenix, Arizona, and the developer of ChildSightTools parent programming. I'm here with my 2-minute weekly tip, which is about anxiety and an extremely tricky little fact that not many parents know, which is that sometimes anxiety is actually walking around masquerading as oppositional and defiant behavior. And I actually chose those terms for this moment because I know that a lot of folks who are trying to make sense of their children's tantrums go online and look up, tantrums, and often land on the diagnostic condition called oppositional defiant disorder. And they say, oh my goodness, my child must have this. We're having these giant blow-ups. Well, I'd like to share that a large proportion of the time in my practice, people bring young children to me who have these out of proportion, extreme responses to things. Large proportion of the time there is some anxiety that's lurking underneath. And I know that sounds very counterintuitive. Doesn't anxiety come out looking like fear and worry? And don't children just say, well, I'm afraid and I'm worried and that's why I don't want to do it? Well, they actually don't. Emotional experiences that are very intense and scary, or that when a child just feels that, the task demands of a certain situation overwhelm their capacity or their ability to do it, they often have a hard time putting that into words and instead put it into behavior that can look oppositional and defiant and like, I am not going to do this, can look like, they're standing their ground and they become an immovable object and they're not going to do this and they're calling you terrible names and it's horrible. My tip for today is just to keep your mind open in moments like this. Could anxiety possibly be underlying things and causing this tantrum? Visit drbethkids.com for more helpful online resources that could be of help to you. Thank you for joining me.